too. But I want to say that when the community works together, and I want to commend Letitia because it's her students. Now we got young people to get involved to work with seniors. And these young people, and I guess Letitia has to tell you about them, but they were fantastic. And I have to give you a lot of praise for organizing and bringing them, because without those young people this summer, we would not be able to do the health awareness and screening that we did for the hundreds of people that have been blessed through that area.
Okay. Lakeisha, we've, again, put on outreach shows. Outreach, made commitments to the community with outreach health events, health awareness events. Now, I've asked you to be a part of the team. You became part of the team. Now, how do you address your students and make them become part of that team? What do you do as a mentor? How do you go about this?
Okay, well, when you take any type of training, you really don't get any hands-on practice. So that's how I address it to them first. This would be a great hands-on experience. But even though they're taking the class, they don't understand the complex nature of the job and the needs of the patients. So by participating in health screenings, they're able to actually talk to real patients that they'll be working with. They're able to give them pamphlets on various types of topics that they would be of interest to the patient, referrals to programs, as well as being able to help someone and give back, which is important in this job. You have to be compassionate. So they benefit because they'll be more ready when they actually start their job, and they're also doing something, helping someone else.
Right. What's been the feedback so far from your students?
Positive, wonderful. When is the next screening? Tell Dr. O'Brien hi. Dr. Burkett, was a pleasure. They love doing it.
Right. And on my website, I have a lot of pictures for the students and Lakeisha and demonstrating their skills. Again, very important to make a holistic approach. It's a comprehensive approach to make a difference in the community. And this is the panel. This is leaders. You want to be involved. Again, if you want to volunteer, be part of the team, you can contact Bishop Burkett at the phone number that's going to be provided, as well as through our websites. Very important here. I just want to go over some statistics. Again, I like to go over statistics because it really demonstrates and gives an impact of how serious this nature is. Out of all in New York State, 100% of those individuals who are uninsured, 60% of those uninsured live in New York City. That's significant. And you know how large New York State is. We're talking New York City is just a little speck on the map when you look at New York State. So 60% of the uninsured out of the entire New York State is located in New York City. Also, we have a couple of points I'd like to bring up. How do we address, and this came from, again, the Department of Health and Hygiene. They made some suggestions how to make a difference in our community, and I just want to, there's 10 points that we must cover, and you can get this information from the site itself and the study. They address these issues. The first point is have a regular doctor or healthcare provider. We want to demonstrate continuity of care by not bouncing what we call doc hopping. The second was be tobacco free. Keep your heart healthy. That means control your blood pressure, watch your cholesterol, and lose weight. Know your HIV status. You don't want to be positive and being sexually active and spreading disease. And I'm going to say this for all sexually transmitted diseases. Very important. Again, you have to watch out for yourself and your community. If you get help for depression. So if you're depression, seek help. Again, mental health is part of your mind, your body, and your spirit. Again, a holistic approach to health. Live free of dependence of alcohol and drugs. Again, also tobacco. Tobacco is a drug. It's addictive. Get checked for cancer. So depending on your age, we have certain screenings for breast cancer, for colon cancer, prostate cancer. Very important. We know that not enough black men go for a PSA, which is a prostate check for prostate cancer. Need to get involved because high risk, black men are the #1 group, highest risk for prostate cancer. Get your immunizations. So when you're a child, your infant, make sure you have all your immunizations, and when you're an adult, make sure you have your adult immunizations. Make your home safe and healthy. Remember fire safety, that's part of your health as well. You need to have your fire detectors, your CO2 detectors. You also have to have an escape plan if there is a fire. Do a fire drill. You must educate and enrich your community. This is part of safety. Again, your safety and your community. And also, have a healthy baby. Again, it's globally speaking, make sure you have your appointments, continuity of care, immunizations, take care of your health. Now, I'd like to go over, Lakeisha, she's also a CPR instructor. Again, this is part of now her professional, we went over her professional life. This is more of her personal life, what she does on the side. As a CPR instructor, give us a little input on why you got involved as a CPR instructor and how you're helping the community.
Okay, well, one of the reasons I became a CPR instructor was to further my education. Another reason was actually because I was really interested in learning CPR and learning how to save a life due to things that I experienced in my own family. I feel that it's not only important for healthcare workers to know CPR, but also for family and friends and people in the community. I was speaking to a friend the other night on the phone, and her baby was choking in the middle of the night. She didn't know what to do at first. She panicked, but she had taken a course, so she knew what to do. So this is something that can affect a family member's spouse, a coworker, a stranger, and people don't want to take it because they feel it's too technical, too hard, they don't have time, but it's really a watered down version, and it really creates familiarity, and you will be able to actually save a life.
So that's important. Again, having the entire family take this course, very important. In my teens and early 20s, I was a CPR instructor also. If you would like to become a CPR instructor, there are two communities that you can get involved with, and that would be the American Heart Association and also the American Red Cross. And through there, you can get certified as a CPR instructor, and then you can go further on and become a certified CPR and then become certified as a CPR instructor. And again, you can make a difference in your community.
Letitia Grant, she's going to be teaching a course on CPR right here at Church Alive. And for those who would like to attend that course, contact our office. The telephone number is going to come up on the screen, and you can be part of that training session that's going to be held right here at Church Alive. Okay? And if your pastors are out there, and I think all churches should have one person or maybe more that knows CPR, because some things happening in the church, some can be choking or going through something, and no one knows, or you're doing the wrong thing. So I realize that, okay? So therefore, we are going to make our Church Alive available for you to come and to be trained.
Excellent. Again, it's very important. Just again, we'll stay with the CPR. As an adult and you have a child, you want to make sure you're giving your child and your family the best care. The last thing you want to do is panic and do something wrong. You can actually make the condition worse. Let's say the person, besides the CPR, you're going to learn about choking, foreign objects, especially with children. You know, they can swallow quarters or pennies and nickels, marbles. And when you're educated, you're going to know what to do. If you don't, you can make the condition worse, and we can have the end result can be disastrous. Now, what would you do? What would you suggest for individuals who would like to make a difference in the community? Like you're a medical assistant, registered medical assistant, not just a medical assistant, but a registered medical assistant, and you're an instructor. For our viewers out there, what would you suggest for them how to get involved, like become a medical assistant? What's the process? What did you do to become a medical assistant to make a difference?
Okay, well, this job is not for everyone, but if you want to help out and help people, it's very, very rewarding. And becoming a medical assistant, you'll have a lot of skills, including medical administrative skills as well as clinical skills. This will enable you to network, meet different healthcare professionals. You can also volunteer and make yourself available in your own church, in your own community outreach centers, and make a difference.
Right. Very important, yeah. Okay, now
Can I make a comment?
Sure.
I was just looking at some statistics here. The New York State percentage of practicing Black and Latino physicians versus the population. You have 4 Latino physicians to 15